Hello everyone, my name is Craig Hankin and I'd like to welcome all of you to today's webinar, Prediabetes and the National Diabetes Prevention Program. As many of you know, the Clinical Health Coach, sponsor of today's webinar, is a leading trainer of health coaches for the clinical setting. Our mission is simple: building capacity to deliver highly effective, personalized health improvement and care management strategies with your patients. Our coach training equips healthcare professionals as behavior change specialists and care management facilitators capable of truly partnering with patients, improving health behaviors, building self-care skills, inspiring accountability, and of course, achieving better outcomes. The Clinical Health Coach specializes in training staff for ACOs, PCMHs, and a host of healthcare organizations across the United States. We currently offer 3 training options designed to fit your individual or organizational interests. The first is our flagship, a 5-day on-site training. The second, our highly rated online training. And lastly, our fusion training, a merger of our self-paced online program combined with a culminating 2-day live intensive. Each program is highly performance-oriented and focused on building practical skills. If you or your organization would like to engage your patients at a whole new level, visit our website, clinicalhealthcoach.com, for more information and training options. Now, I'd like to introduce the presenters of today's webinar, Katie Jones and Karen Crimmings. Katie is the Diabetes Primary Prevention Coordinator at the Iowa Department of Public Health and works to raise awareness of prediabetes and evidence-based diabetes prevention programs across the state of Iowa. Karen is the Chronic Disease Prevention and Health Promotion Service Manager at the Cerro Gordo County, Iowa Department of Public Health. Today, Katie and Karen will explain the purpose and the benefit of supporting the National Diabetes Prevention Program. They'll also describe the role of health coaching in the hopes of preventing type 2 diabetes and wrap up with the steps in becoming a CDC-recognized National Diabetes Prevention Program organization. We are excited to welcome both Katie and Karen as today's webinar presenters. Take it away.
Thanks for having us here today. So I'm going to be talking about prediabetes and the National Diabetes Prevention Program. For the learning objectives, I hope that after this presentation, all of you will be able to explain the purpose of, the benefits of, and the evidence supporting the National Diabetes Prevention Program. I also hope that you'll be able to describe the important role that health coaches have in preventing type 2 diabetes. And finally, I hope that you'll understand more and be able to describe the steps in becoming a CDC-recognized National Diabetes Prevention Program organization. Next slide. The main points, really if you're going to take away any points from this presentation, these are the 3 main ones. The first one is that 1 in 3 adults in the U.S. have prediabetes, and that most adults with prediabetes don't know they have it. The second point is that type 2 diabetes can be prevented or delayed, and one of the best ways we know to do this is through the evidence-based and cost-effective National Diabetes Prevention Program. And then the third point is that health coaches really do play a pivotal role in diabetes prevention. Next slide. So this is just a quick disclaimer saying that there's no intent to have legal advice or an opinion on any specific legislation with this presentation. Now I'll be talking about prediabetes. So first of all, prediabetes, what is it? It is a health condition that's characterized by blood glucose levels that are higher than normal, but not high enough yet to be considered diabetes. So you can see here 3 common diagnostic tests in the normal range, the prediabetes, and the diabetes range. Prediabetes is right in between that normal and diabetes range. And prediabetes means that someone is at increased risk of developing type 2 diabetes, heart disease, and stroke. Next slide. 1 in 3 adults have prediabetes. That's about 86 million American adults. And about 9 out of 10 people with prediabetes don't even know that they have it. So this is a really major public health problem. Next slide. This slide really shows that diabetes is actually the tip of the iceberg. There are about 29 million Americans with diabetes, but under the surface there are 86 million with prediabetes, and many of them don't even know that they have it. Next slide. One of the things that's being done to try and raise awareness of prediabetes is this prediabetes awareness campaign that was created by the Ad Council with the CDC, the American Diabetes Association, and the American Medical Association. And there are a variety of different videos that are out there, bus ads, and then also, next slide, there's a great website called doihaveprediabetes.org. I really recommend that you check this out if you haven't already. It has a risk assessment on the website where you can fill out to find out what your risk is for having prediabetes. It has some great tips, and it's a really user-friendly website, really friendly on the mobile site. Okay, next slide. And these are the risk factors for developing prediabetes. Having a history of gestational diabetes or the birth of at least one baby weighing more than 9 pounds also increases your risk. And then also being African American, American Indian, Hispanic, Asian American, or Pacific Islander also increases one's risk. Next slide, please. You might be wondering, if someone has prediabetes, what's the likelihood of them developing type 2 diabetes? So people with prediabetes are 5 to 15 times more likely to develop type 2 diabetes, and without weight loss and moderate physical activity, about 15 to 30% of people with diabetes go on to develop type 2 diabetes within 5 years. So in a relatively short time frame, a fairly significant portion of people with prediabetes develop type 2 diabetes. Next slide, please. The risks for people with diabetes are significant. So the risk of death for adults with diabetes is 50% higher compared to adults without diabetes. Diabetes is a very costly disease. There are a lot of medical costs, lost work and wages, and then also people with diabetes, especially when it is not managed effectively, or if they don't know they have diabetes, they are at increased risk of very serious health complications, including blindness, kidney failure, heart disease, stroke, and loss of toes, feet, or legs. So clearly diabetes is a very serious condition. Diabetes management is also important, but since we know we can help prevent diabetes, that's the ideal. So next slide, please. This just shows that healthcare expenses are higher for those with diabetes. They're about 2.3 times higher compared to people without diabetes. Next slide. So with that, the good news is that prediabetes is treatable. We can prevent or at least delay type 2 diabetes from developing for many people. And research has shown that lifestyle change programs like the National Diabetes Prevention Program can prevent or delay the onset of type 2 diabetes. And they do this through 3 main things. The first one is that there's modest weight loss. We're talking about 5 to 7% of body weight. So for a 200-pound person, that's 10 to 14 pounds. Losing that and then maintaining that has shown to be effective. Also, healthy eating and gradually increasing physical activity to 150 minutes per week. These 3 things really do help prevent or delay type 2 diabetes. And I know many of you are already aware of this, but hopefully this is a good overview. And then the next slide, please. The value of delaying or preventing type 2 diabetes, many of you are familiar with this too, but I think it's important to reiterate this. From a health system perspective, there's a lot of value in preventing type 2 diabetes in terms of reducing costs. But from a societal perspective, there's also a lot of benefits also for quality of life reasons, for improving the quality of life of the population. So I just want to say this is really important work. Next slide. Now I'm going to talk more about what the National Diabetes Prevention Program is. So it seems sort of like a no-brainer. Oh, of course, physical activity and nutrition and those things are going to help, but it's hard for people to do that. So this program is really shown to be effective, and part of the reason it's so effective is because it is a year long. We all know, and you all know, behavior change is very hard, so having this be a year-long program that's group-based, so there's group support, really helps with the success of the program. So these are classes that meet usually for about an hour, and they meet weekly at first in a group-based setting. So it's all people with prediabetes or at high risk for type 2 diabetes meeting together weekly at first for 16 weeks. Then it transitions usually to biweekly. Some programs go straight to monthly. Many have a biweekly period in between, and then eventually monthly maintenance classes. They are taught by trained lifestyle coaches. These coaches are not necessarily health coaches, but can be. Some have nursing backgrounds, some have a dietitian background, and some have a community health worker background or more of a lay person that has been trained to provide these classes. It's evidence-based, and I will go much more into the details of the clinical trials based on, but it has been shown to be effective for preventing or delaying type 2 diabetes, and it can also be cost-effective or cost-saving. And it's delivered in a variety of settings. This includes community-based organizations, work sites, and healthcare organizations, so ranging from a YMCA to a grocery store like Hy-Vee to a hospital or clinic, and there are also online programs. Next slide, please. The National Diabetes Prevention Program is led by the CDC, and these programs have to adhere to certain CDC quality standards. The YMCA, I want to just plug, also is a national partner, and they offer the YMCA Diabetes Prevention Program curriculum, and there are many other national partners, including the American Medical Association and the American Diabetes Association. Next slide. The classes, there are many different curriculums that are approved by the CDC, but they all have to meet certain standards, and they're all based on a large clinical trial that I will talk about soon. So Prevent T2 is one of the newer curriculums that was released by the CDC. It is available on the CDC website. You can look at the curriculum. It's all there. All the handouts and everything are available on the CDC website. And the overarching goal of this program is to prevent type 2 diabetes. That is the focus. And the focus is making lasting lifestyle changes. So this is not just a, get slim, quick 5-week course at all. It's definitely focused on making these lasting lifestyle changes, and it also builds up to making these moderate changes for diet and physical activity. So it doesn't start off with you have to drastically change everything in your life. It very gradually builds up that capacity so that people are able to make these changes and have them stick. Participants are weighed at each session, and there are participant materials that help support these program goals. Next slide, please. The classes go over a lot of different topics, but some of the main strategies they discuss include self-monitoring, diet and physical activity, building that participant self-efficacy, and building that social support. Again, having it be a group-based class really helps contribute to its success, to maintain these lifestyle changes. And there are also problem-solving strategies for overcoming common weight loss, physical activity, and healthy eating challenges. And you all, as health coaches, are very familiar with these as well. Next slide. So you might be wondering, how much does this cost? So the average cost, it really varies by site. So I would strongly recommend, if you aren't already in touch with your local program, if you have a local program, that you get in contact with them to find out how much they are charging. The average cost nationally is about $500 a person. All YMCAs charge $429 a person, but there are scholarships available. Some programs aren't charging anything or are charging a very low amount of money. Also, some insurances or employers cover the cost of participating. Self-pay is an option. I'll talk more about which insurers or employers are covering it. And some programs offer scholarships. And some offer incentive pricing, so they might charge a rate up front, but then you get some of that back if you attend certain classes or if you accomplish the weight loss goal. Now, additional costs for participants include the time and travel to the program as well. Next slide. For current coverage, many employers are providing this, and I also encourage you to talk to your own employer to see if they would be willing to cover this, especially if you're looking into possibly setting up a program at your own work site. That's a great way to pilot it to allow employees to go through it with no cost. Private insurance, it really varies by state and by insurance company. United Healthcare is one that is a big champion of this nationally. For Medicare, Medicare is going to be covering this. This was a big announcement earlier this year, beginning in January 1st, 2018. For Medicaid, it really varies by states, and the managed care organizations vary by state. Some programs do offer scholarships, and again, self-pay is an option. So I would get in contact with your local sites. Next slide. So this was the pyramid I was talking about that just showed that the program is really focused on people who are at high risk or very high risk for diabetes. So if someone, for example, or if someone is just over age 45 but has no other risk factors, they wouldn't be eligible for the program too. Having just one or two risk factors, you wouldn't be eligible. It's really focused on the people that are at high or very high risk. So then I'm going to talk now about the evidence behind this program. This program is based on a large randomized clinical trial that was done over 15 years ago now. And this trial, basically, they took a bunch of people with prediabetes, over 3,000 people, and they randomly assigned them to one of three groups. One of the groups was called the Diabetes Prevention Program. This is that lifestyle change program that's group-based, talking about these issues. Then another group was formed where people were put on the drug metformin, and they were also given the standard lifestyle recommendations, which is basically a healthcare provider says, oh, you have prediabetes, you should eat healthier, be more active. They talk for a little bit, but then that's it. There's nothing after that. Then the next one was a placebo pill, and then the standard lifestyle recommendation. They found at the end of this study, which was about 3 years long, that the diabetes prevention program was the most effective. It resulted in a 58% reduction in the number of new diabetes cases overall. And for people over age 60, it was even more effective with a 71% reduction compared to the placebo group. I like to say if this program were a diabetes pill, it would be the miracle diabetes prevention pill. Everyone would be prescribing it. You would see ads for it. But it is a lifestyle change program. And we know that the healthcare system is still it's changing, but it is still very focused on prescribing and kind of waiting for people to develop a disease and then helping them rather than trying to focus on prevention. So basically, overall, the diabetes prevention program helped prevent 1 case of diabetes per 7 people that participated. And there are other results from other countries that have done similar studies as this. So it's not just the U.S. that found this. China and Finland and other countries have found similar results for similar programs. So the study itself was seeking to answer, does the DPP, the diabetes prevention program, or treatment with metformin prevent or delay the onset of type 2 diabetes? And they found that both do, but that the diabetes prevention program was the most effective. They also found that it did differ in effectiveness for older people. For people over age 60, it was even more effective. They also were the people that did the study were very concerned with if this differed based on race or ethnic group, since there are so many diabetes-related health disparities. So it was a very diverse group of participants, and they found that it did not differ based on race or ethnic group or sex. So that was really good to hear. About 45% of the participants were from minority groups. And you might be wondering, okay, so where does the National Diabetes Prevention Program fit into this? The National Diabetes Prevention Program is what's called the translation of the Diabetes Prevention Program, which means it is the version of the Diabetes Prevention Program that was created for dissemination nationwide. So since this landmark study, there have been a variety of other studies showing how the National Diabetes Prevention Program can be implemented, that it is cost-effective, that it is feasible to implement this in community settings, including YMCAs. And so that's sort of where we're at now. We have over 15 years now worth of data showing that there's still a benefit for attending this program. And also, this program didn't just help with diabetes prevention program. It also helped with metabolic syndrome, high blood pressure, triglycerides, other health conditions too. So it really did help a lot. This just shows that 10 years later, they're still seeing an effect. For the people that participated in that program, there was still a 34% reduction compared to placebo 10 years later. And then the next slide just talks about how this is a very cost-effective program, and in many ways it can be cost-saving. There's a great calculator that's available. I would recommend going to that website. This is especially useful for hospital systems that are thinking of covering this, for work sites, health departments, any group that is thinking of covering this program, insurers. That's a great tool to look at to figure out, okay, if we did cover this, would we actually save money? Next slide. There is a registry of recognized programs that the CDC maintains, and so I recommend checking that out. I know for Iowa, if you're in Iowa, I have a list of the Iowa programs I'd be happy to share with you that includes a few more that aren't necessarily on the CDC's list yet but are thinking about it, just so you don't think there isn't anything in your area. But I do recommend checking out that. And this talks a bit more. Basically, the program has to submit. They get pending recognition status, and then they have 3 years to attain full recognition. And that full recognition hinges on certain data that you send to the CDC. Okay, here's Karen.
All right, good afternoon. Thank you. So the next part that we're going to talk about is the STAT process, or the Screen, Test, Act Today. And you can look at this process is really used to identify adult patients with prediabetes and referring them into prevention programs. There is a toolkit online that can be accessed, and we're going to go through that in a little bit more detail in just a bit. But it is developed from the Medical Association, American Medical Association, and the CDC, and it's really meant to either be used at point of care or retrospectively. This next slide really talks or shows you what the Prevent Diabetes Stacks toolkit looks like. And within this toolkit, there's some very helpful sections. The first section really talks about, it provides a guide on info on what the diabetes prevention program is, such as who's eligible, how individuals can find programs, or how providers can find programs. It also talks about encouraging providers to start screening individuals, and if they are found at risk, that they can go ahead and refer patients to a diabetes prevention program. There are some wonderful tools that are within this toolkit that offers talking points for providers and educational flyers that they can share with their patients. There's also some very nice, useful letter templates that providers can use so that when they do identify a patient that is diagnosed with prediabetes, that they can let that patient know. We're going to look at this in a little more detail in just a few minutes, but there's a sample flow process on how they can identify patients within their clinic setting to determine whether or not they are pre-diabetic. And then there's some helpful tips about how to refer patients, again, into DPP. We're going to look at this again in a little bit, but really how do you identify patients retrospectively via EMRs? And you can really look at your patient load and be able to identify those patients that you want to take a more closer look at. And then there's also a very nice section there, and it talks about commonly used CPT codes for screening patients, such as the fasting glucose or the hemoglobin A1C or gestational diabetes. Next slide. This next slide it shows you a picture of a screen assessed risk. And this particular tool is to be used with patients, and it really goes through different questions such as how old are they a man or woman. I'm really looking at some different risk factors that may have them score points. In this particular assessment, if an individual scores higher than 5, they are considered at high risk, and this is also found in that toolkit. The CDC also has a nice screening toolkit that you can use and you can find online. And I believe that particular screening, if you score 9 or higher, it does identify a patient at risk. One thing that we did at our particular program at Saragordo Public Health is we took this tool, the screening form, and I had my IT and webmaster develop it. And so individuals could go to our website and they could take this particular screening right online, and it was made that it then provided feedback to that individual what was their score. And if they scored 9 or higher, they instantly were given a link that they could enroll into our program. And we really have had some great success in getting people to enroll in our local DPP program because they didn't know that they were at high risk, and this was their way of getting engaged and introduced to our program. So the next part is really talking about testing, and we're really looking at how you can test and identify patients within the clinical setting. And we're looking at evaluating blood glucose levels based on their risk status. Again, we're talking about fasting glucose levels, and hemoglobin A1Cs tend to be the two main ones that are used. We also can look at retrospective methods, and I think this would be a great place for health coaches to be looking at their current client load and looking at, are these patients have a BMI higher than 24, and have they been tested? Have they had a fasting glucose level or hemoglobin A1C to see if they are in pre-diabetic range? And if so, then let's go ahead and look at talking to them about engaging into a program if it's going to fit for them and getting them referred into that local program. The American Diabetes Association's recommendations really look at having you test patients with prediabetes or type 2 diabetes in asymptomatic patients. And so they want you to test adults of any age who are overweight or obese and have additional risk factors for diabetes. These other risk factors could include high blood pressure, family history of diabetes, they are inactive, or they've had a history of gestational diabetes. Without these risk factors, they're saying go ahead and start testing individuals at 45, and if they test within normal limits, the recommendation is to go ahead and repeat that testing again in 3-year intervals or as you see reasonable. This slide here shows some very helpful codes for testing for prediabetes. These are codes that can be used when doing fasting glucose levels, hemoglobin A1Cs, and again, that STAT toolkit also provides some very helpful tools as well. As Katie had mentioned, coverage and reimbursement varies by each insurance company, so I would highly recommend that individuals check into their individual insurance company. And as she also mentioned, CMS is looking at, thankfully, covering this DPP program in January of 2008 as it's looking anyway. I'm sorry, 2018. Next slide. So the next section of this is Act Today, and we're really looking at the point of care method, how we can see individuals that come into the clinic and counseling them on prediabetes and treatment options. Do they even know what their status is? Do they understand what prediabetes is? That's the first step that we really need to be looking with individuals. As Katie had mentioned earlier, only 1 in 10 know that they have prediabetes, and so that's the biggest challenge I think that we have is we've got 86 million people walking around the United States that have this, and most of them don't know that. So we really need to be talking to them about what is prediabetes and really what is their status. And if they are at risk or they are diagnosed with prediabetes, trying to get them engaged into a local DPP program. Now, with that said, that program needs to be appropriate for them. Are they willing to take that step? Are they ready to take that step? Because it is a 1-year commitment, and not everyone is going to fit within this box, but the ones that do, it is a great tool to help them prevent or delay prediabetes, type 2 diabetes in the future. And then we want to share patient contact information with the program provider. Getting engaged in those local DPP programs, finding out what they have to offer, and we'll talk a little bit more about that in just a few minutes. I did mention earlier about the retrospective method of informing patients on their prediabetes status via mail, email, or a phone call. There are templates in that STAT toolkit you can use, making them aware of the referral process and sharing and showing them where those programs are locally, referring patients to diabetes prevention programs, and then sharing patient contact information with those programs. We need to get these patients engaged in that program. So in our area, our particular program really reached out to our health coaches, and I specifically reached out to Population Health and said, hey, can I come in and talk to the health coaches? These coaches have a relationship with their patients. They know what patients are going to fit into this particular group, and they have those trusting relationships that they can talk to these patients about this program. We've got this wonderful program, but we need to reach out to those individuals so that we can reach them into this program, and so that's very important. So NDP and the YDPP sites need to engage and communicate with our local diabetes prevention programs, and we need to establish a process to receive feedback from the program about our patients' participation. It's one thing to ask. Our particular program, we're out there asking the providers to referral patients into our program, but we also need to keep in mind that we need to be sharing that information back with them. The health coaches and the providers, they want to know how their patients are doing. They referred them to us, and so we need to develop that system where we can be providing that information back to them as well. We also need to partner with our patients. We need to explore motivating factors important to that patient. So we talk about social determinants. And we really need to be looking at that with those patients. You know, they're a sponge and they're going to take in all the information of what they should be doing, but sometimes life gets in the way and what they should be doing doesn't always happen. And so we really need to be looking with those patients and finding out what is their need. How can we meet those needs so that we can continue to have them successful within the program? We also want to partner with patients and having them at follow-up visits and reviewing blood tests and really looking at how are they doing in their journey of preventing or delaying their type 2 diabetes, and discussing program feedback with patients and integrating that into their care plan. So this particular sample patient flow process is something that will be very helpful for clinics to use, and it really just goes through a process. And how do you start? As we mentioned, there's 86 million people walking around with prediabetes, and where do you start? And so this kind of provides that nice tool. And it's really indicated for patients 18 and older. Reason being is that DPP is really indicated for adults 18 and older, and so that's why this sample flow process is made that way. We want to review medical records and determine, is their BMI 24 or higher? If it's not, they don't need to be in this program. If it is, let's check a blood glucose on them, whether it's a hemoglobin A1C or a fasting, to see whether or not it's elevated. And then we can go ahead, if it is elevated, to refer them into a DPP program so that we can encourage to improve their lifestyle changes, to make more healthier lifestyle changes. They can improve their nutrition, increase their physical activity, and really looking at the social determinants that are in their way and how they can deal with stress and triggers that may make them choose unhealthier lifestyle changes. So what can you do? We're really looking for health coaches to champion the prediabetes awareness in the NDPP program. As we mentioned before, a lot of people do not know about prediabetes. They don't know about these programs that are out there. We're also looking at screening and testing patients for prediabetes and then referring them if they are elevated. We offer with our particular program, it's not a requirement for NDPP, but we do offer hemoglobin A1C screenings at the beginning of our sessions. And I can verify that most people do not know that they have elevated levels. Out of the group that we have, I would say that we've got about 60 to 70% that present to us, and they end up with elevated hemoglobin A1C levels. And I would say the majority of those individuals had no idea that they were elevated. We do have some that enter that have been told they're pre-diabetic, but a good portion of ours had no idea. And so I think this just confirms what the research is showing is people don't know. We also want individuals to make the business case to worksite decision makers and health insurance companies to have this as a covered benefit. As Katie mentioned, this could be the golden pill if it was a pharmaceutical. It works. It really works. And so we need to get people on board that recognize this and are willing to give it a shot. And it really should be something that is covered. As Katie also mentioned, it has improved on not just type 2 diabetes prevention, the triglycerides, the high blood pressure, the obesity that we are looking at in the nation. This is a wonderful program that works in so many different levels. And then we're also looking at wanting health coaches to collaborate with the local NDPP, reach out to those DPP sites, learn about what their services are, what is their referral system to get your patient load into a program like that if they are at high risk. And then let them know what you need back. Those sites need to be providing information back to you, but sometimes you need to speak up and let them know that this is important information that I need to know so that I can continue with their plan of care and develop that process so that you're getting that information back. So in summary, what we're really looking at is screening and testing patients for prediabetes so that they know what their status are. If they are at risk or they develop they're pre-diabetic or they have an elevated hemoglobin A1C or fasting glucose, refer them into a program and then follow up with them on their progress. This is a one-year program. It does take time. It's a lifestyle change program. It's not a weight loss program. Yes, we want people to lose weight with this program, but in order for them to be successful, we have to change their lifestyle habits. Partnering with local NDPP or YDPP sites are key to this. And collaborating is essential. We can't do it all alone, and the community needs to collaborate together, and it can really make a strong and successful program. So the next slide that we're going to talk about is resources. Again, I had mentioned that there's 86 million people out there, and where do you start? And there's so many helpful resources out there. And so the first one that I want to cover is it's the cdc.gov/diabetes/prevention. And so this first slide is the cdc.gov, and it's really based in 6 different sessions. I'll tell you, I have this bookmarked at home, and I go to it a lot. There's a section on there that you can learn about what prediabetes is and type 2 diabetes. There's a section on there for lifestyle change program, and it's really for people that want to start a program or start a program. What do they need to do? What kind of things do they need in place or they need to get in place? There's a third section, and it's for people that want to know about a program and how can they join a program. What does it entail when they join a program? The fourth section is testimonials from participants and what their experience and successes were. The fifth section is finding a program. So Katie had mentioned about being a recognized CDC site, having pending recognition or a recognized site, and meeting certain required outcomes. And so you can apply to become a site, and then your site is put on a list. So individuals can go on this website and put in what state they're from, and it will provide a list of local programs so that they can go ahead and reach out to those programs. And then the last section is talking about national DPP efforts and what all goes into that. So I would highly encourage, if you have not visited this site, this is a great place to start to just really learn about NDBP and how to become a recognized site and what all that entails. Next slide. We already looked at this a little bit, but this is the Prevent Diabetes Stat Toolkit. Again, this is a wonderful site that I would highly encourage you to visit. It has all those wonderful talking points, templates, patient flow charts, letter templates, just a wonderful toolkit that I think you will find very useful as you're progressing through this process. This one is talking about Steps Forward. It's a module that is really used from the American Medical Association. It's an online module for physicians. I believe there is a 1 CME credit if physicians complete this. And it's talking about preventing type 2 diabetes in at-risk populations. So this is just another tool that they can use to familiarize themselves with this process. Next slide. This was a slide that was in the presentation originally. This is the So Do I Have Diabetes site. And this particular slide, you can take that risk assessment test. I believe it's the CDC risk assessment. And this is for the general public to go to. This is also a nice site where they can find a local DPP program. There is some helpful things on tips to lower their risk for developing type 2 diabetes. And then there's some frequently asked questions that individuals can review as well. The next slide, this is actual picture of the cost savings calculator. And this particular site is very useful for work sites. What it does is it provides a return on investment or health cost savings if they were to bring DPP into their work site. And sometimes numbers is what speaks. The almighty dollar, when you're looking at work sites, that's what speaks to those higher ups. So I would encourage you, if you're going to talk to work sites, to use this tool and really show them. And it's very specific to their particular work sites. They ask about what their population size is, how much they think they're going to pay for the cost for the program, the prevalence of prediabetes, and if there was a percentage of enrollment and completion. And then it gives them the bottom dollar of how much they would save if they were to have this program at their site. So it is a very useful tool as well. And it was created by AMA. Next slide. This is a really nice tool. It's stopobesityalliance.org. And what it is it's a guidance on how to initiate conversation with adults about weight and health issues. I think it's easier said than done sometimes. How can you have an open, productive conversation with patients about weight and what it can provide for risks for them with their health? And so this is just a really nice guidance for providers to use as well. The next slide talks about, for people with chronic diseases, there's DSME, and then there's the Chronic Disease Self-Management Education. Both of these programs can be used. DSME is for people that have been already diagnosed with diabetes. It's kind of set up similar where it's typically a group session for the most part, and people can talk about how their journey is in controlling and managing diabetes. And they become a group with support as well. It is 10 hours long, generally about 1 to 2 hours. There is some individual counseling, but it needs to be, there needs to be a good reason for it. They really want it to be a group session. CMS, Medicare, does pay for some of this. Many third-party payers also cover these services. Some of them are subject to deductible, though. And so, again, I would suggest that if an individual is wanting to take part in this, that they should check with their insurance to find out what their coverage is. And then the Chronic Disease Self-Management Education, you'll also hear it called Better Choices, Better Health. These are classes for people that are diagnosed with diabetes or other chronic diseases such as arthritis, lung and heart disease. It is an online program, and it teaches skills on managing their chronic diseases as well. And it can also be given in person as well. So in conclusion, again, I'm going to go through what Katie had mentioned. The 3 main points we want to have participants take out of this is 1 in 3 adults in the United States have prediabetes, and unfortunately most people don't know that they have them. It's our job to help them find that out. Type 2 diabetes can be prevented or delayed through this wonderful evidence-based and cost-effective National Diabetes Prevention Program, and you as health coaches play a pivotal role. You have built trusting relationships with your patients. You have unique training as health coaches to help improve the ability to not only engage but activate your patients. You have access to EMR records to help identify those patients. And you have relationships with those clinical providers to actively identify those patients. Use those tools. They're huge in really engaging and actively getting these patients involved in these programs.
Okay, any questions?
Great. Thank you, guys. That was great. I do have some questions for you, and so I'll go ahead and feed those to you now. The first one is, what are some lessons learned in getting people to participate in DPP?
So this is Karen. I think the biggest tool is to get patients engaged in your program and for them to learn about that. So we really had to reach out to the providers, to the health coaches, talk to them about our program, and develop a very easy referral system. And so if you go on our website, which is cghealth.com, I would encourage you to look and see how it's worked so well. There is an enrollment page that we have, and health coaches or providers can go on there. I think we ask about 3 or 4 questions, which is basically the patient's name and a contact information, a phone number. We then take on the responsibility of contacting these patients. We know that there's a lot of work involved in the clinics and health coaches are busy, so we take that on and we get these patients involved. But the other thing is engaging the public, the general public. And so by having us have that screening test on our website and it giving them their own status immediately, providing that enrollment link immediately so that they can get in. The other really neat thing that we did recently is we offered a drawing. And so when individuals went in and finished this screening tool, their name was automatically put into a drawing for a Fitbit. We had like over 300 people in our local community that took this test, and not all of them enrolled in the program, but at least they knew the status. I do believe we got over 30 people that enrolled in the program by doing this, and it was like a 2-month thing. A Fitbit is $99, if you can imagine how much media costs to do this, and this was a $99 strategy that we did. And then we did a drawing, and some individuals got a Fitbit from that, but it was a really great strategy that worked better than I had ever imagined. And so that's something that I think we're going to continue to do, is just engaging them, letting them know and finding out what their status is and getting them into the program. Now there's a lot of other things that go along with a year-long program and how you need to keep them engaged, but just getting them in the door is the start.
Thank you so much, Katie and Karen, for your time today. I just really appreciated all the information you have. I'm sure our participants did as well. I'll remind you, Katie and Karen's contact information is posted on the screen right now. If you have any further questions, don't hesitate to contact them at the information shown on screen. And so with that, thank you for participating, and I look forward to being with you again soon. Have a great day.